Our overall goal was to eliminate 560 hours of weekly work from our processes. So the effort we undertook really was looking at over 30 process improvements to help us achieve that goal. And we branded that effort Innovation Nation. So one of the processes where we got our greatest benefit was looking at emails that were coming into our division. So we realized that multiple people within our organization were receiving emails, and then they needed to basically reroute those emails to get it to the right end user to solve whatever that problem was for our client. So one of our efforts took all of those emails that were coming in, and we created a process to automatically send those emails to the user who needed to service that client. The easier we can make it for our clients to do business with us, the better we feel that experience is for our client.
Our department has been, for more than a decade, on our Lean Six Sigma journey and have been using the tools for many years. And it turns out in 2015 and 2016, we offered to everyone in the department refresher training on Lean Six Sigma use of tools and concepts. 18 different modules that we taught every employee towards a white belt certification. We don't intend to stop now. We have many projects planned for 2017 for further improvements, both in quality and waste reduction. And we do have advanced training towards the yellow belt planned for the future for employees that are interested in taking it further. As a result, we've had our aggregate toner cost come down by 10%. Waste as measured by a percentage of product produced dropped by 40%. And customer complaints for quality dropped by 60% over that 2-year period. Now I think we have many more people engaged and many more people understanding what we're doing, how the improvements are being made, and how to use the tools.
Camp Salamares in 2016 celebrated its 90th summer, 90th year in existence. So it was pretty exciting for all of us. So we're a traditional summer camp. You know, this day and age, lots of kids come to camp. It could be our camp, could be any camp. Come with medications, vitamins to diabetes medication to insulin, and need to check those in with our medical staff on Sunday drop-off. And so, you know, when you're dropping your child off at camp, you want to spend time with them. You don't want to be waiting in line. So we've worked really hard to make that experience as quick as possible. It took a real look not only from the side of our nurses and what they needed, because they need to be able to talk to the parents, but the side of, from our parents, what did they need out of it? And coming to, you know, we ran through a lot of scenarios. We're lucky enough that we can do it at camp, and we can sort of lay out everything and walk through the process. You know, here's parents dropping off their child with us, and we always, in all of what we do, have to look at it through their eyes.
One of the things that we undertook when we kind of committed to universal screening for depression in our practice was the introduction of iPad at the time of check-in, so that people could answer the PHQ-2, which are screening questions for depression. That has allowed us to better identify and in real time address those concerns.
So there was a day that I was paged by Dr. Phillips, and she had a patient in her office that had scored really high on the PHQ-9. He was a patient who was coming in for shoulder pain, so that was an unexpected outcome. I was actually able to meet with him that day. I did a full suicide assessment, and I did some safety planning. And what I discovered is this was somebody who was suffering from symptoms of post-traumatic stress disorder. One thing other that he revealed to me is he had been drinking, and his description was that the alcohol use actually helped with his sleep. I went with him every week for a little while, and I eventually transferred him to somebody out in the community who specializes in post-traumatic stress disorder and EMDR, a certain type of therapy for that.
Holy Sepulchre Cemetery has been around since 1871. It occupies 340 acres bordering the Genesee River, Lake Avenue, and Dewey Avenue in Rochester, New York. And there's 250,000 plus people buried there today, and it continues to grow. Many of the employees within the organization, both in the field and on the staff, have been with the organization for 20 plus years. And as a result, our workforce is beginning to age at this point in time. So from a planning standpoint, what we're looking at doing is making sure that we have that continuum both from a training and development standpoint. There's training and development that goes on as part of the succession planning. So the succession planning is key to making sure that, number one, we have the people to operate the cemetery, but also the people that are trained and in a position to safely bury people, but also maintain the grounds. So that's a big piece of it. And it's also making sure that, like I said, we carry on that tradition and carry that high level of quality that people have come to expect from our organization. Everybody would like to say they're going to be in business forever. We have to be. The minute somebody is buried on the ground in a cemetery, that property has to be maintained forever.
Calero was formed about 3 years ago. We merged 3 companies together. You're not fully integrated until you get single processes, right? So we had a lot of, like, for example, 3 different teams potentially doing pretty much the same thing in 3 different ways. So we created a business system that started with our mission, vision, values, strategy development to define the strategy of the new company. Then we implemented strategy deployment, which also in Lean is sometimes called policy deployment, to drive that through the organization. Then we implemented Kaizen methodology for continuous improvement. And lastly, we aligned all of the individual performance targets with that system. This wasn't about one team. This was literally about, changing the culture of a whole organization, and again, merging, 3 different organizations' cultures together and having one, unified culture.
We manufacture the Kodak Next Press digital production color press for the commercial print industry. And our team is made up of several individuals from operations, process engineering, service engineering, and field engineering. Factory quality is one of the key metrics that we have, and we actually make the improvements in the operation as we're building the digital press. We make sure that we have all the quality checks as we're building the assemblies that go into the making the digital press, and then we close the loop by talking to the customers and our field engineers as they're doing the installations and using the press, to make sure that we understand what issues they're dealing with and we can make process changes. It's a very collaborative process, ensuring that we've gone over all of the issues or concerns that they have and making the improvements in the operation. And then we've used the Lean principles like Kaizen, Gemba, standard work to make the improvements on the digital press.
Back in 2014, the corporate office was closed down. The corporate Lean Six Sigma office had to be closed down. It was a business decision. But the various groups within Xerox knew that we had a need for Lean Six Sigma. We took a look at what was left after the corporate office was closed, what our needs were, and decided that there was a lot we could do to keep it going. One of the gaps, for example, was training, so we had to pull together a training team that developed our training program. We also looked at economies of scale for software acquisitions. It's much more expensive if we were to buy individual software licenses. We were able to save on one software package alone over $60,000 just buying the type of license we needed. We also knew that we needed a standard for certification for yellow belt, green belt, black belt, master black belts. I think for Lean Six Sigma, having a passion, believing that it is the way to do business is critical.
We are from Hillside Family of Agencies. We provide services to children and families across much of New York State.
B2H stands for Bridges to Health. Our program serves children who have serious emotional disturbances, who have developmental delays, and who are medically fragile. And so what we did with our project was to really look at how we could serve them more effectively. What this process enabled us to do was to have the waiver support specialist talk to the other side, which would be the health integrator, who really is a coordinator of services. And so what it did is it cut down on repetitive processes. We were able to gather information from the family that would benefit both sides of the program. We have a greater commitment to continuous improvement in that with B2H, and also we have a greater commitment to communicating with one another and making sure that the right people are at the table and having the conversations and the information that we need is being shared.
Our company went through a system conversion from 7 claim processing systems to 1. And coming out of that system conversion, we experienced a very high volume of claim adjustments. When a claims processor adjusts the claims, they put a reason on the claim why we adjusted it. And if it's a generic description, then he doesn't understand it, then they'll end up calling back to us and saying, what was the reason for this adjustment? We reviewed all the adjustment reason codes. We eliminated a lot of the generic ones. We updated the database so it kind of steered people into specific categories. So at the end, once we had everything in place, we piloted the old way against our new process. We saved the 3,600 claims over a 7-week period. We annualized that and it come out to be about $73,000 worth of savings.
We are a continuum of home care services, one of the largest in the region, serving patients in the 7-county area, providing certified home health aide services, licensed home care services, and hospice services. So I was the new CEO early in 2015, and when I came on, we had a bit of a burning platform in terms of our financial results. We had a negative 8% margin, and there was obviously some real concern about sustainability around that. Because of broken processes, we were not getting paid for a big percentage of the business we were doing because we didn't have the right insurance verification or the right insurance authorization or the documentation to support the care that was being done. 2016 was our year of lean. Now we're going into kind of a forever lean, but we called it Destiny in that first year, and it was really looking at all of those, primarily the biggest ones, the biggest processes that weren't working well, and creating strategies and using lean techniques to come up with better ways of working.
So our project started off as a telephony replacement project. So the original goal was to take all of the copper and replace it with new technology, and also to roll out new phones. So it started off as basic equipment swap essentially, but as we began working through it, we realized that the technology offered a lot more that we could do to bring value to our service providers and also to our customers. So we started to roll out tools that allow us to capture information about all the phone calls that they make, so that when a customer calls in, the service provider would automatically see records of all the conversations that we've had in the past. We introduced technology so as soon as a call came in, we'd be able to identify that inbound phone call, that phone number, match it to a database that would then tell us their payroll specialist, so we could automatically get them to the person they wanted to speak with without them having to do any effort at all. So for Paychecks, we want to make sure that we're always providing the best service possible, and our phones are one of our key ways that we interact with our customers.
Our project was really designed to address some concerns that we had about improving our length of stay, improving our readmission rates on an inpatient psychiatric unit. Longer hospitalization does not equate to success. It doesn't mean people are going to leave healthier.
We looked at this and said that really 3 tenets of this: education, communication, and collaboration were 3 big things that we needed to focus on. And the education wasn't just simply about educating families and patients about what inpatient care meant, but it was also about us, the providers, being able to use a language that we all understood. And then could share clearly with our patients.
With this redesign, we were able to do very much the same thing, but quicker. Right at the onset of an inpatient admission, we could start working on discharge planning. Patients were not only being discharged in a shorter amount of time, but we were seeing patients reach their next level of care.
I believe when we started the project, our average of folks linking to outpatient care was at times as long as 7 days. I think we've gotten our linkage down to 2.8 days.
I would say, as medical director and as a hospitalist at Strong since 2004, that probably 98% of the time, within 24 hours of the patient being in the hospital, we can predict how long, based on your diagnosis, that you're going to be in the hospital. Strong is almost always at 100% or higher capacity. And so when you go to ask New York State for more beds, then we feared that the state was going to say, well, your average length of stay is much higher than other medical centers doing the same thing, having the same patient population as you do, so why should we offer you more beds? And so the administration said, okay, we need to really look at our process of patient flow coming into the hospital, going out of the hospital. What keeps them longer than at other institutions? So we realized a couple things. One, we need to communicate better with the families in terms of setting expectations. So you come into the hospital on April 5th and we say, you know, Mr. Smith, we think you're going to be ready to go home on April 8th. They have a whiteboard in the room. We write it on the whiteboard, the date. In addition, we realized that our nurses are so busy that they weren't getting patients out of bed in a timely fashion. So now, say you take Mr. Smith, who's 90, and you don't get him out of bed until day 3, now he may require skilled nursing facility or a nursing home, as opposed to being able to go back to home with his wife, which of course is where he wants to be and makes the family feel safe and happy as well. So we hired a mobility specialist. She's wonderful, and she gets almost every patient out of the bed every day, walking them around the unit. We're learning more and more that there are barriers to discharge, and that is where we're going to strive for the future, is to identify the barriers earlier in the admission and solve them.